Hello, I'm Dr. Costa, one-stop solution for Mrcp PACES course mentor, and this is my course link. My course link is also given in the description box of this video. Today I would talk about how to approach a station 2 case in the PACES examination. First, I would like to give you a brief overview of the Mrcp PACES Station 2. In Station 2, you will have a total of 20 minutes, of which 14 minutes are dedicated to history taking, 1 minute to collect your thoughts, and the last 5 minutes for presenting the case according to the history, formulating the differential diagnosis list, and answering questions from the examiners. You would be given 5 minutes of time, a pen, and a paper before entering the examination room. You should use these 5 minutes intelligently and productively. They will also give you a scenario in these 5 minutes. Ideally, you should formulate a list of possible differentials during this time according to the scenario given. Please be mindful that the examiners will test you for 5 clinical skills out of 7 clinical skills in Station 2. If you are someone completely new to Mrcp PACES preparation and you are unaware about the 7 clinical skills tested in the PACES examination, then I recommend you to first view my Introduction to Mrcp PACES video. The video link is given in the description box, or you can alternatively click on the I button. In a Station 2 case, you would be tested for the following 5 clinical skills. These are clinical communication, differential diagnosis, clinical judgment, managing patients' concerns, and maintaining patient welfare. Your scenario for today is a 40-year-old lady named Christina had tiredness and both lower lymphedema for last 2 months. Her GP gave a blood test that showed microcytic hypochromic anemia. Now she came to your hospital to talk about her medical condition and blood test result. You are a junior doctor in the hematology clinic today. Please take her history and advise her accordingly. Now imagine this scenario is in your hand and you have 5 minutes to enter the examination room and begin history taking. Please be mindful that in Station 2 you can only talk to the patient or surrogate. You cannot touch the patient or try to find out any clinical signs. The station will progress solely based on the history given by the patient or surrogate. Now in 5 minutes time, you should be thinking about the list of differentials according to the scenario. The scenario mentioned microcytic hypochromic anemia. So what are the differentials of microcytic hypochromic anemia? We all know that the most common cause of microcytic hypochromic anemia is iron deficiency anemia. So your list of differentials should include it. Here is your list of possible differentials. Iron deficiency anemia due to blood loss from any body orifice, menorrhagia, etc. There are some GIT causes like peptic ulcer disease, inflammatory bowel disease, angiodysplasia, malabsorption, for example celiac disease, and malignancy. Some hereditary causes of microcytic anemia are thalassemia and hereditary hemorrhagic telangiectasia. There are some drug-induced cause of GIT bleeding, for example NSAID, steroids, aspirin, and blood thinner medications, for example warfarin. Now your 5 minutes time is over. You have finished the list of differentials and heard the bell ringing. Now is the time to enter the examination room. In the examination room, the session should progress according to the following flowchart. Introduction, symptom analysis, ask about the list of differentials, systemic review, social history, summary of important data, concerns, and discussion with the examiner. Now I am going to explain all these steps one by one. So first one is introduction. Enter the room, simply say greetings to everyone present in including the examiners. You can simply say good morning or hello. They will tell you to sit down and start taking history. Introduce yourself to the patient or surrogate. You can introduce yourself by simply saying, hello, I am Dr. X. I am one of the doctors in hematology clinic today. Then confirm the patient's identity. Ask the patient, are you Mrs. Christina, 40 years of age? And she will tell you, yes, I am. Then mention the agenda of today's meeting. Your agenda is to discuss about the patient's health condition and the blood test result. Then tell the patient that you may take some notes during the discussion, but these notes would be highly confidential and your full attention will be on her. Then simply ask, can you tell me more about the discomforts you are having? Then the patient will start giving you the history and she will talk about her symptoms. While she will talk about her symptoms, you should ask about the onset, course, duration, progression, aggravating factors, relieving factors, and associated symptoms. You can ask the onset like this: how did your symptom started, or how did your feeling of tiredness or fatigue started? Did it start suddenly or gradually? You can ask about the course like this: when do you feel more tired, during the morning hours or during the evening time, or is it same throughout the day? You can ask about the duration like this. You can ask, when did your feeling of fatigue exactly started? And she will tell you it started 2 months ago. Then you should know about the disease or symptom progression. Is your tiredness increasing or decreasing or remaining at the same level in last 2 months? Then you should ask about the aggravating and relieving factor. Is there anything that improves your symptom, or is there anything that makes your symptoms worse? Some surrogates are not very helpful, that they would answer these questions in a straightforward way, so you should give them some hints like, is taking rest helps you, or is there something that makes it worse, for example doing a lot of work. Then ask about the associated symptoms. You should not ask the surrogate that, do you have any associated symptoms? No. Instead, you would ask her that, is there anything else bothering you, or do you think there are any other discomfort that I should know about? Then the patient will say that yes, she does have an additional discomfort, and that is her both lower limb swelling for the same duration. In station 2 case, whenever a patient or surrogate will tell you that she does have an associated symptom, you should ask the onset, course, duration, progression, aggravating factors and relieving factors of that associated symptom as well. That would end the symptom analysis part, and in more than 50% of cases you'd be able to reach a diagnosis at this point. Your next step is to ask about the list of differentials. For iron deficiency anemia, you can ask, do you have any blood loss from your body orifices, for example your mouth or your back passage? Any excessive menstrual bleeding? If yes, then ask, how many tampons do you use per day during menstruation? If it is more than 6 tampons, then definitely she is having excessive menstrual blood loss. Are you taking a balanced diet? Because for some patients, malnutrition can be a cause of iron deficiency anemia. For excluding malignancy, you can ask about any lumps or bumps, any weight change recently. For hereditary conditions, you can ask, do you have any known medical condition, any medical condition running in your family? For drug-induced causes, you can ask, are you taking any medication? Painkillers, steroids, aspirin, or blood thinners in particular, any over-the-counter medication, any herbal medication at all. And if you don't mind, I would like to ask, any recreational drug use? For excluding other GIT causes, you can ask, do you have any mouth sore, any loose motion, any black stool? Has anybody noticed yellow discoloration of your skin or eyeball? Any acid brush, tummy swelling, tummy pain, feeling of sickness or vomiting? Any history of previous hospital admission? Do the symptoms worsen if you take gluten-containing foods? At this point, if you think that the main diagnosis for this case would be a GIT related cause, then you should take detailed stool history and detailed urine history. You should ask about the amount of stool, color of stool, is it too much foul smelling, consistency of stool, is it watery or is it hard, the frequency of bowel motion, and is it blood mixed or mucus mixed. Detailed urine history should include amount of urine, color of urine, odor of urine, appearance of urine, frequency of water work, and any pain during passing urine. Now you will progress to your next step, and this is systemic review. Here ask 2 to 4 questions from every system. Exclude the questions you have asked before. For central nervous system, you can ask, do you have any headache, any visual disturbance, any weakness, any altered sensation, abnormal gait, any shaking, any uncontrolled water work or bowel motion. For cardiovascular system, you can ask, any racing or pacing of your heart, any chest pain. For respiratory system, you can ask, do you have any cough, any phlegm, any coughing up blood, noisy chest, runny nose. For genitourinary system, you can ask, is there any problem in your private parts, any ulcers, like this, because you have already asked about the water work in details, so you should not ask about amount, color, frequency and frothiness of urine in this part. For musculoskeletal system, you can ask, is there any skin rash, have you noticed any muscle pain or joint pain. Before taking the sexual history, you should always seek permission from the patient. May I ask a few personal questions if you don't mind? This is considered as the maintaining patient welfare skill. So you can then ask the patient, are you sexually active? Do you have any partner? How many partners do you have? You have already taken the menstrual history, so you should not ask it twice in this section. For hematology symptoms, you have already asked a lot. For traveling history, you can ask that, do you have any recent traveling history? For medical history, you should be asking about, do you have any known medical condition like diabetes, hypertension, heart disease in your family? For surgical history, you can ask, do you have any history of surgical operation, any dental procedure, any blood transfusion, any history of tattooing, piercing or needle sharing? For family history, you can ask, do you have any similar condition running in your family, if not already asked. The drug history, you have already taken it, so in this part you should not repeat it. If you get a station 2 case who is a female of reproductive age, then never ever forget to ask about 3 P's, and 3 P's are pills, period and pregnancy. So you should always ask, do you take any oral contraceptive pill? Do you think that you are pregnant, or are your periods regular? This will end your systemic review part. Your next part is Social history. Here you would ask her about her occupation. What do you do for living? About her family members. How many family members do you have? Is everybody doing well? Then you should ask about her financial condition. Are you financially sound? Then you should ask about her smoking and alcoholism habits. If she is a smoker, then you should quantify her smoking habit by asking how many sticks of cigarette for how long. And if she is a drinker, then ask about the amount of alcohol she takes per week. If she mentions any difficulty in her occupation, then always tell her that you'd refer her to the occupational support team after this consultation. If she tells you that she has some financial problem, then offer social support at the end of your consultation. At the end of social history, you should start summarizing the important points you have gathered so far from the history. And then you should ask her, is it all, or do you want to add something else? Never ever forget to ask about the concerns. You can simply ask, may I know what is your concern today? And then the patient or surrogate will ask you several questions. Some of the questions can be, what disease am I having, doctor? Is it curable? Am I having a cancer? Am I going to die? What is the treatment? Do I need to get admitted to the hospital? Let's assume that this lady has a concern, and that is, am I having a cancer, doctor? Then you should tell her that I appreciate your concern. We have to do full examination and investigation first to confirm our diagnosis. Cancer is very unlikely at your age, and according to the history, I think the more likely cause is iron deficiency. So we are going to run through some of the tests, and we would include our multidisciplinary team, including a gut doctor, internal medicine specialist, a blood doctor, and many other specialists. And then after the investigations, we can tell you the diagnosis, and we will definitely exclude the cancer. After addressing all the concerns raised by the patient or surrogate, your history taking session should end, and you'd have 1 minute to collect your thoughts. Then your examiners will start asking you a lot of questions for the next 5 minutes. Some of the expected or common questions from the examiners in station 2 are, what is your diagnosis, and can you tell me the list of differentials? What investigations are you going to give her to exclude the differential diagnosis? What is your treatment plan? Do you think this patient needs hospital admission? While answering what is your treatment plan question, you should always divide the treatment plan into 3 categories: general management, pharmacological or medical treatment, and surgical treatment if necessary. After answering all these questions successfully, your history taking session would end. In this video, I have given you the general approach to MRCP PACES Station 2 case, and I have also given you an example of microcytic anemia case, but there are many cases to read for MRCP PACES Station 2. I would discuss the approach to all important cases for MRCP PACES stations and give my own personal notes that made me race through the PACES examination to those who would subscribe to my PACES course. Thanks for watching this video.